let me tell you what I have in my office. Does that sound okay? Interesting things in my office here. Um, okay, what is this? This is counterfeit toothpaste. And it was toothpaste that I was able to help get off the market when I worked at the Food and Drug Administration. And you know it's counterfeit toothpaste because there, can't really see this, but there are a lot of spelling errors in the package. So that helps. If you're buying toothpaste, there really should not be spelling errors on the package. What does this look like?
A really big Q-tip.
Yeah, what's at the end here? Can't really tell. It's like a ball. I'll give you a hint. Its flavor is root beer.
A lollipop.
Okay, good. We're getting some lollipops. What kind of lollipop? I'm seeing the chat. Oh, why was there counterfeit toothpaste in the first place? There's counterfeit toothpaste because it's cheaper than the official Colgate, and it can be sold cheaper. So it might show up in dollar stores or other places where they sell things cheaply. And so people will pack, it might not even be toothpaste that's inside, or it might have chemicals. In fact, I think this particular toothpaste, the reason I got it is because it had some potentially dangerous chemicals. Lollipops to stop smoking. All right, I'm gonna give a prize to someone who thought it was a lollipop to stop smoking because this is actually a nicotine lollipop. Now, it was being sold unregulated in all kinds of flavors in bags like this. This was the root beer flavor, but they had a million flavors. You know, you can imagine what flavors they had. This is well before even electronic cigarettes. And they had enough lollipops in them that a child could get really sick if they had just 2 lollipops, or small child 1 lollipop. So there was no evidence that they worked or how to use them, and so they came off the market. Okay, anybody recognize this candy? This is like a lemon salt kind of sweet candy. It's called Lucas Limon. It was made in Mexico. And for a period of time, it was contaminated with something. What was it contaminated with? Not cocaine, but good guess. Lead. Ishida gets the answer correct. It was very heavily contaminated with lead, and kids were getting lead poisoned all the time. And I actually went at one point and met with the company that manufactures it when I was working for a member of Congress. And they said that they didn't think it was a problem because the kids in Mexico liked the taste of lead. And I was just appalled by that. I'm a pediatrician, and we insisted, and eventually they took them all off the market. But I kept one. You can see I keep all the things that I take off the market just to keep in my office. If you're ever here at Johns Hopkins, you can visit. All right, here's another one. What is this? Cough medicine for kids. Yes. What's the problem with this cough medicine for kids? And I'll give you a hint. It's not poisoned or contaminated. There's no lead in there. But this is actually what they intended to do. Okay, Aiden says it might not be safe. That is true. There were babies that died of this. In fact, there were 4 babies that died of this when I was in Baltimore as the health commissioner well, a couple of them were before my time, one was during my time. And it wasn't that safe because the mom might give a dose, the grandma might give a dose, and what they call the margin of safety, like if you take more than you're supposed to, how safe is it? The margin of safety is very small for this, and kids were getting into trouble, and they were, in some cases, even dying. And there were like over 100 cases the FDA found. Besides the fact that it's not that safe, and there's a low margin of safety, what was the other major problem with this? No codeine in here, actually. They were absolutely marketing to parents. They were telling parents that this was so you can sleep too. So they were saying, if you're a good parent, you give this to your kids, even though it wasn't safe. This was a dropper and aimed for little babies. So it was, these babies couldn't open it because they were too small. But what else would you like a medicine to be in addition to safe? Taste probably was tasty. Effective. Go back up. Somebody said effective. Very good. Veda. It's supposed to be effective. There were 6 studies of this medicine, and not a single one reduced cough or congestion. So it didn't work, and it wasn't safe. So I was a health commissioner, and we had 4 babies die. So we wrote a petition to the Food and Drug Administration. You can look it up. And on the basis of that petition, these came off the market for the whole country. You can't find a dropper of this kind of baby medicine. But I got one before they went off the market. All right, let's see. What else do I have here? Anybody recognize this? Yes, it is an eyeliner. And this particular one was causing lead poisoning because there was a lot of lead in it. And so we had to do an import alert. And in the back of it in Urdu, it says, if you want your children to never need glasses, rub it into their eyes at night. But this one was, around their eyes. But actually, it was a hazard. And so, the supply of cosmetics around the world is not entirely safe. It's not all products like this that have this problem, but this particular product had this problem. And so in my career, I've had the chance to identify things and try to get them off the market, but it can be a big challenge. And then there's this one. Anybody recognize this? For Loco, it's not iced tea. Correct. So this is a drink that before your time, I know Four Loko still exists, but at the time it was a different drink. And one big can like this had 5 alcohols worth of beer, or 5 beers worth of alcohol, and 5 Diet Pepsis worth of caffeine, plus a lot of sugar. And what's the problem when you give people a lot of caffeine and a lot of alcohol at the same time? Probably does make you want to pee. That's a good point. But what can happen is people can have a sensation of wide awake drunk. So you're drunk, but you don't feel drunk. So you don't realize what's happening. Normally, alcohol is a sedative, and you pair it with caffeine, people can have a strange reaction, so they can drink a lot more. And so there were young people who were having to go to the hospital and some dying from alcohol poisoning. They were assaulting each other. People were getting into car accidents. The story was that you would go to a party and you get 2 big cans and you'd have to drink both before you could even, get into the party. So people would wait outside and they would be completely, impaired by the time they get in. And it was really a huge problem. It was a big story in the country. Attorneys general were getting involved. ER doctors were upset. And so when I was at the Food and Drug Administration, we took these off the market too, on the grounds that, every time I say something's been taken off the market, there's a law that allows you to do it. And the law in this case was the law about food additives. And the FDA determined that in order to add caffeine to alcohol, it has to be safe. But the company couldn't prove that it was safe, so they had to take it off the market. For the cough and cold medicine, those medicines had to be generally recognized as safe and effective, and they weren't safe or effective. How do you find these things to take off the market in the first place? Usually they kind of found me. So like I'm just, minding my business and something crosses my desk or I read about it. I'll give you another example. When I was the health commissioner, I read a medical journal article about a little girl who had, a little boy, I think, who had Reeboks, if I'm not mistaken. And there was like a little metal thing dangling off the shoe and he ate it. He was like 6 or 7 and died of lead encephalopathy from the lead. And so we tested the children's jewelry in Baltimore, and we found that it had high lead levels at a store called Claire's. Do you know Claire's? And so I used my legal authority as the health commissioner, and we took all those products off the market. But it was only because I read that article. Now, for the Four Loco, I got a letter when I was working at the FDA from state attorneys general saying that they were very worried about all the harm that was happening. For Lucas Limon, I don't remember anymore. For the nicotine lollipop, someone sent us the advertisement, and I was like, "You've got to be kidding! That's strange." I actually have a couple other items here. I have. I don't think you can get this now, but this is called Nicowater. Somebody put water, nicotine in water, not a small amount of nicotine. Doctor recommended smoking substitute, but they've done no studies to prove that it works. So this also came off the market, but I kept a copy of it. Anyway, I got one more. I got one more here. And then this, what does this look like? You can't quite see it. What kind of container is this? It's not a drug vial, actually. There should be something in it, but it's stuck to the top. Something you put in your eye. Contact lens, yes. This is a contact lens that was a colored contact lens that didn't change your prescription. They're called Plano Lenses. And in the mid-2000s, the government deregulated them. So you could buy them at like a gas station or a beach store. And so young people were putting all kinds of things in their eyes. And you really need to make sure if you do a contact lens that it's the correct size. Otherwise, you get like ulcers on your cornea, or you can get horrible, nasty infections. And so kids were going blind. This one was, it was a dollar sign. It says money on it. I don't know if you can see that. It says money. It was a dollar sign. So you would have like dollar sign in your eyes. And so I kept this one, but we passed a law. Congress passed a law. Trying to get it to come free here. Congress passed a law to take these off the market. And so you have to get a prescription even for Plano lenses now, because you need them at the correct size. So, you know, being a regulator, which is one of the things I've done in my career, is a pretty interesting dimension of public health. It's very important everywhere around the world, in the United States, other countries, because there are products people try to make money off of that can be quite dangerous. And so somebody has to protect the public health. That's a good thing to do. Yep, Sarah, do you have a question?
Yeah. So I wanted to ask, since you said you worked with the FDA, and recently the FDA had been preventing like trigger states post the overturning of Roe v. Wade from banning abortion products in their state. How does government organizations like the FDA play a role when states are trying to ban products that they pass as consumable and safe?
It's a really important question, especially in the wake of the recent court decision. So FDA, there's a federal law that gives FDA the power to decide what prescription drugs are on the market. And federal law, particularly for interstate commerce, trumps state law. So typically, if the FDA allows a product to be marketed, a state cannot take it off the market. And this was actually tested by Deval Patrick, the governor of Massachusetts, maybe a decade ago, when he wanted to get an opioid off the market that the FDA had approved, and the court struck it down. The court said, you're not allowed to do that. So most people think that because RU486 and the other medicine you take with it for an early abortion are safe and effective, they're approved by the FDA, that a state cannot ban their use. The legal questions that come up, though, have to do with, well, what could the state do? Because a state that is really opposed to abortion might try to do other things. They might say, you know, if you tell someone about it, or you run a website where they can get at it, or maybe if you order it, you know, it's fine to sell, but you just can't buy it in the state of, you know, Mississippi or something. So I think that it's going to be an interesting fight. The Biden administration has said that they are strongly behind the authority of the FDA to decide what people can have access to, and it'd be inappropriate for the state to interfere with that. So that could well become a court case and could well lead to additional legislation. But FDA is very much in the hot seat over this. Now, a year ago, one of the important issues that came up was, for a long time, FDA refused to let the medicine be prescribed by telemedicine. It had to be in person. When the pandemic happened, the FDA switched to telemedicine. And the question was going to be, at the end of the pandemic, would the FDA require it to be in person? If it had to be in person, that would make it much harder for people to get. So FDA looked at the evidence of whether it needed to be in person and decided it did not need to be in person. And so now, regardless of the pandemic, people can order it through telemedicine. And so it is, you do not have to, according to the FDA at least, be in an in-person visit. So that really makes it possible for people to have access even from states that have banned abortion. What exactly happens is not clear. Now, very interestingly, there's a nonprofit organization based, I think, in the Netherlands, that where there's a doctor who you can go to the website and she'll send people the abortion drugs. Now that is illegal to do because it's not necessarily approved drugs, but you get a sense of just the different, how hard it is to try to control things when they come in through the mail. So it's going to be, I think there's going to be a lot of questions about enforcement as well as jurisdiction that come up in the courts. Great question.
Thank you. And Dr. Sharfstein, thank you so much for coming back. This actually was like my previous question, so it kind of ties into what just was asked. So like of course, between like the last time we saw you, the Supreme Court decided to overturn Roe v. Wade, eliminating a woman's right to privacy and the constitutional right to abortion. I myself am not in the United States, but this still does affect Canada because it still like raised the question as to why it's not in our constitution right now. But I think a lot of us, many of us know that this will not really prevent abortions from happening. It will just prevent safe abortion. So how will this affect the public health sphere in general, like in terms of like maternal mortality rates and all that?
It's a great question. It's not going to be good for public health. And our dean, Ellen McKenzie, is the first woman dean of the School of Public Health, has been extremely outspoken about this. She is very, very concerned about the impacts for health. The evidence is that the greater access to reproductive health care, the less maternal mortality. I actually recently, I'll put it in the chat, did a really interesting, hold on one second, a podcast with another doctor about the implications of this decision. And she is an obstetrician gynecologist. She was actually in clinic when I talked to her. And it's worth listening to because she talked about the concerns that she has for women's health, particularly the health of pregnant people. And she talked about that right now, abortion is an option in a lot of clinical situations. Like you could have a situation where something is seriously wrong with the pregnancy and you're not sure, or maybe there's the membranes rupture and there's a potential for a serious infection. And typically the doctor would sit down with the patient and walk through all the options and the risks and benefits. But now one of the options won't be available in some states. And that will mean that the risk in general will be shifted to the patient. And she said, no question, there'll be higher maternal mortality as a result of this. And the evidence really does bear that out. And it's the public health impact, though, goes much beyond unsafe abortions or the inability to get an abortion, both of which can be lethal. But it goes to the impact on the family, the impact on other children. There's a lot of evidence about the risk of mistreatment when children are not wanted. There are issues, huge public health impacts to the impact on the economy and particularly on women's participation in the economy. And so it's pretty serious. And that's why the dean has been sending out messages. And I think in many hundreds of public health experts have said that this is a terrible decision so far. That's kind of the basic, I think, perspective of a lot of people in public health who are looking at reproductive health from a public health lens.
Hello, thank you so much for coming back. I know my question might seem like a little weird or unnecessary, but recently the the FDA has put a ban on Joule e-cigarettes. Is the reason why because Joule e-cigarettes are mostly bought by minors illegally, and used by minors illegally?
Good question. So the law in this case has a standard for new tobacco products. Anything that came on the market after sometime in 2007 had to prove that it made the world a better place, that the benefits to public health exceeded the risks. And there was a grace period for them to put forward data and say, Joule really does make, is better. And, you could imagine they could make an argument, like maybe it's not as unhealthy as smoking a cigarette and people will switch from cigarettes. So they gave them a chance to make that argument. They gave them all kinds of information about what kind of evidence the FDA wanted to see. And they kept postponing the deadline, postponing the deadline, postponing the deadline. And eventually they said, sorry, Joule, you cannot stay on the market because you haven't given us evidence that the benefits exceed the risks. And, I think part of the challenge that Joule has is so high in nicotine content. So it's so highly addictive, and so many young people got addicted that way. I think they really had a tough case to prove probably to the agency, and the agency just said, sorry, you haven't proven it. Now, if they do more research and they want to try again, they're allowed to. But it really didn't have to do particularly because of underage cigarette purchase, underage Joule purchase.
Hello. So I was kind of gonna back off of that question. I know that the FDA banned it, but then there was also reprieve, like in the future, because like they temporary gave them a ban so that they still are able to sell it to a certain extent. And I was just gonna ask, like, how does the FDA even regulate like whether who can sell their drug, like how much can they? Because they put a ban and then they reprieved it, and that's where I was a little bit confused. And the second part of my question is, how do lobbyists impact the ability of what the FDA can and can't approve?
Oh, and when you say it, do you mean Joule?
Not Joule, but specifically any drug. Like, how do lobbyists impact that?
Right,
Just
but
say if
before your
something's-
earlier question,
Yeah.
when you said they banned it and then it came back, was that Joule or something else?
Yeah, that was Joule specifically. Like,
Yeah, well, so far they've just announced that it's coming off the market. Joule is trying to get a judge to stop the FDA from doing that, but they haven't actually done it yet. There are all kinds of lobbyists hovering around FDA. Almost every decision FDA makes is a life or death decision for a company of some kind. Or if it's not a life or death decision for the company, I shouldn't say life or death. It's like bankruptcy or, riches for the company. One time I was involved in a decision at FDA about which company really had the second application in, because the second application got some extra benefit. And, we made the decision, and then fast forward 5 years later, I'm at Johns Hopkins and someone knocked on the door and introduced themselves. They said they were the CEO of the company that I decided against. And they said to me, we just want you to know that decision cost us $1 billion. And I said, I didn't know what to say. Like, sorry? I mean, I don't know. We tried to make the best decision we could, like everything. And so they have lobbyists, they have lawyers, they're constantly trying to, what that means for the agency is that agency has a lot of lawyers, agency has to do things correctly. We have to document our decisions, explain them, have to, do the best job. And you can't have sideline conversations with people while you're making a decision. The process is very, very, has to be squeaky clean for people to have trust in it.
Hi, thank you for coming in. It was really great to talk to you again, but my question is kind of irrelevant to what you were talking about before. My question is more specifically on just general food labeling. I know that the FDA has a part on food labeling, what has to be labeled, what doesn't. How does that process and I guess the outcome impact consumers, and how does it impact, I guess, general public awareness, but also just the market itself? Does labeling something mean less people buy it, or how does that really work?
It's a great question. So there are different kinds of food labels. So one is the basic nutrition facts label. Like if you look on food in the United States, it has a nutrition facts on it. It tells you what % of the sodium and what % of the calories and what percentage of calories come from fat. And all that is set by the FDA. And there's a lot of research into what people are looking for and what information could they use. But that sort of passive labeling sort of sits on the back. So some people look at it, some people don't even look at it. There's another kind of labeling where you could put it on the front. And you could be like, this gets, the green thumb, for something that's super healthy, or this gets like the poison logo, or, something maybe not that extreme, or like 3 hamburgers or something for something that is not maybe as healthy. And right now, the FDA doesn't really have a big system. Other countries, and some of you may live in these countries, do have systems like that. Like there's a stoplight on the front of the pack. And so it's like, it's red, it's yellow, it's green. So you eat more green food, you'll be healthier. You eat more red food, not so good. The United States has never really been able to do that. Instead, companies have come up with their own things, and they tend not to have too many reds. when the companies come up with it. So that's an area of a lot of interest for FDA. The other type of labeling has to do with genetically modified foods. It's a really hot topic. And so there are some foods that are genetically modified, but really that genetic modification does not pose any particular safety issues. So under the FDA's law, there's no requirement that those be labeled that way. Some people think, well, it should be labeled so that people know. But the FDA will take the position that because there's no difference for safety, there's no reason for people to know, so we're not going to require it. And in fact, if people start advertising like, hey, we're not genetically modified, we're safer, the FDA will actually come down on them and say, if you cannot say something that you're safer when there's no evidence of that. So that's always a controversial topic for FDA to deal with.
Hi, Dr. Sharfstein. Thank you so much for meeting with us again. I am from Arizona and I am a rising senior. My question is, recently the COVID vaccine has been approved by the FDA for children around 6 months to 5 or 6 years. Do you believe that this vaccine will have as much pushback from parents as other vaccines given around this time have in the past?
Yeah, I think it'll probably have more pushback. I think that if you compare it to like measles vaccine or chickenpox vaccine or pneumococcal pneumonia, the regular vaccines, almost all parents, want their kids to have. They're often required for school entry. This is a new vaccine. I think people have heard a lot of misinformation about it. And so I think that it's going to be a challenge. There's one thing that I think is in favor of the vaccine, which is that most, people that age, they get their vaccines from their pediatrician. They don't necessarily go to the supermarket to get them. And pediatricians will have access to the COVID vaccine. And I think a lot of people trust their pediatrician. So as a pediatrician, I appreciate that. And I think what'll happen is that parents will come in and they'll be getting other shots, and the pediatrician will say, I really think the risk of COVID is real for your baby, and this will protect them. And I think it might actually be a little higher than some of the older kids who don't see the pediatrician as much. Excuse me, but we'll have to see what happens. And of course, if they're eventually the medication may be actually approved rather than just authorized, fully approved. And when it's fully approved, I would expect we'll start to see some vaccine requirements, and then you'll get a lot higher participation because in order to get into daycare or school, kids may need to be vaccinated, but that's in the future.
Thank you.
Hi, thank you for answering our questions. I wanted to know, what is in the public health sphere and the medical community? What are currently policies that are well supported and championed to expand access to safe abortions, especially in the wake of the Supreme Court ruling? I've heard some options about making it legal by codifying Roe, opening clinics on federal land, and I was wondering what are current actions that can be taken either by the president, other government agencies, or Congress to expand reproductive health access.
Thanks. I think great question. It's a question that is very much a hot topic of conversation. And certainly Congress can do it. Congress would have to pass legislation, and right now there do not appear to be the votes to do that. And but that may or may not change. Then the question that you're asking of, what can the administration do? Certainly the administration can support access to medication abortion, so it seems like the administration is doing that. This interesting issue of can the VA offer abortions, the Defense Department offer abortions on federal land is one that I've heard floated, and I don't know enough about the legality of it, whether they would do it, and then they'd have to decide to do it. There's also disaster relief teams and other kinds of medical resources the federal government has. So I think we're kind of in a new world in terms of thinking this through, but I would expect that we're all going to hear more about those types of options because, it's going to be very serious. There are, I think unquestionably, we're going to start to see more maternal deaths, and we're also going to hear just some terrible stories about people who are basically become suicidal because they're being asked to carry a pregnancy to term. That has been known to happen. we're going to hear just some very, very serious stories. And I think that will, that plus political pressure will make this a very present issue. You know, I feel like it's not just that the Supreme Court has ruled since we last spoke, but in many ways the world has changed, not just because of this decision, but also the gun decision. The Supreme Court is setting different ground rules for what we think of as health in this country, and it's going to affect, you know, the field of public health for many, many years, and we're just beginning to think about the consequences. But I think your questions are good ones, and I know people who are working on them right now.
Hello, my name is Singin, and I'm currently in Japan, and I'm rising junior. I want to ask a question about like cannabis in Thailand, because recently they legalized cannabis in Thailand, and that was a kind of big issue in Korea and Japan, since they're like in East Asia, and like Asian culture like really was very conservative for like the drugs and like viewing the drugs. So I would like to ask, like, what's your opinion in like legalizing drugs and like cannabis for like relaxing purposes?
Sure, that's a good question. You know, I think there are two issues. One is, I think we can recognize, particularly in the United States, that like having drugs be illegal can make them less safe and can make enforcement of them very harmful for communities. We've seen that in this country. At the same time, it doesn't make drugs good, doesn't make them healthy. And drugs and drug addiction are very, very serious consequences. And marijuana in particular can cause, you know, major challenges, particularly for young people who use them. Some of them become very apathetic. You know, some people could take marijuana like they're, you know, having a drink, or even, you know, they just get a little relaxed. The next day they're fine. That their friend from across the street though can take marijuana and suddenly want a lot more marijuana, and before you know it, they're smoking like a bag a day, and before you know that, they don't want to go to class anymore, and before you know go any further, they're, you know, could even be having more serious problems. So the overall, I would be worried about a lot of young people, particularly using marijuana, because I know a lot of them are going to run into trouble. There's also pretty good evidence that it can precipitate psychosis, and that, you know, those things aren't healthy. So how do you balance the fact that maybe we don't want to outlaw it and create all these problems on the one hand, but we don't want to like say, oh, this is the greatest thing, it's really good for relaxing, when nothing could possibly go bad. You've got to find some path between those two. And that's where the United States is struggling, I think, in some regards, and states are trying different things to find that path. I'm not necessarily a huge fan of like a huge marijuana industry, because I'm worried of the consequences for kids, particularly for newborns, for adolescents. I don't think that's going to be a great model. I don't think the tobacco example is a really great model for what could happen. On the other hand, I'm not a supporter of the war on drugs. So, you know, figuring out some path in between. Some of those paths could look like decriminalization. They could look like legalization with a lot of regulation. Those are some of the things that I think about when I think about this topic.
Hi, Dr. Sharfstein. Thank you for answering our questions. So my question was with regards to like the warnings on tobacco packages from California Proposition 65 or something, the cancer warnings. So from a legal and regulatory perspective, how do those labels from states like coexist with FDA kind of regulations?
Yeah, okay, good. What's the next question?
Hi, thank you for coming. My name is Vicky. I'm a resident senior in Vancouver, Canada. So my question for you is, given the rise of COVID, and so also the rises of debate around public versus private healthcare. So like many people are advocating for universal healthcare, but others just prefer private healthcare. So do you think what is the reason behind the rise of the advocate for more private healthcare funding? Thank you.
Okay. And Isabella?
Hi, my name is Isabella and I'm from Costa Rica. And well, of course, thank you so much for being here and answering the many questions we all have. And my question is, how is a 20% error margin like decided for the nutrition fact labels? And isn't a 20% error margin a lot for people who have like conditions which might be affected by it?
I don't know what you mean by 20% error margin.
The FDA has a 20% error margin for nutrition facts. So the numbers are not, or the accuracy of the numbers.
Interesting. I'm learning something from you today, Isabella. Thank you for
Oh,
saying that.
okay, thank you.
Very good. And say hello to everyone in Costa Rica for me. I lived there for a while.
Oh, really?
Yeah. Excellent. Okay, and then it looks like Anishka put hers in the chat here. Do you think substance use in minors and adolescents has risen in recent years? What's the potential impact? I'm not so sure that it has risen in recent years. I think we could look at the data on that together. There's some, I think marijuana use has risen, but I'm not sure that overall substance use has risen. I know tobacco use has gone down. Alcohol, I don't think has been rising necessarily. So it's a bit of a mixed picture. And, I think to some extent, everything that everyone does with their devices keeps them from getting into trouble in other ways. Although the devices are their own issue and their own public health challenge. I'll just go back the 20%. I'm not exactly sure what Isabel is referring to there, but it's often that I am, there are all kinds of things the FDA does that I'm not sure about. There is a range, though, around a lot of things that FDA does. And that's just because it's hard to measure. Like if you were to say, what is exactly the amount of sugar in something? Well, it depends, which part of it you take. It might be a little bit different. But to your point about people who have very serious dietary requirements, the nutrition label is probably not going to be enough for them. They may need to have a special diet. And they may need to look very carefully at which foods they can eat. Particularly, I think about children who have certain dietary needs because they have some inborn errors of metabolism. They absolutely need to take a certain amount. Like if you think about the formulas, you can't really mess around. I'm sure the formula requirements are going to be tighter than the 20% because it's sort of like a medical food that people absolutely need. The question about why the interest in private healthcare, in Canada, in the United States, we have private healthcare. There's how healthcare gets delivered and how healthcare gets paid for. So some people want to see public financing of healthcare, like in Canada, to happen in the United States. In the United States, we have private financing and private delivery. In Canada, there's public financing and private delivery. In the UK, it's public financing and public delivery because there's the National Health Service where everybody works for the country. But of course, on the side, there are some private clinics you can go to too and pay extra. So, people debate about this. I think most people in the United States, at least, are interested in private healthcare but public funding because they don't want to necessarily turn everyone into a government employee. But they would like to have some public funding. It is a very interesting question to think about, given how aggressive the court has been. If you turn things into a public funding and a public healthcare system, whether that could leave the system more vulnerable to political manipulation than it being private. And then finally, let's see. There was a question on Proposition 65. FDA permits those labels to be there. But how effective they are is a little unclear because they're pretty much on everything in California. So that's a question that people have, like whether people really pay attention to them. And then, of course, I wrote down the other one. I wrote down low objective, but I do not remember what that was about. Someone remember?
I think that might have been my question, but I believe I wasn't able to unmute before, but it was about how the FDA ensures objectivity when it
Oh,
comes to taking products off
how
market?
objective? Yes, great question.
Yes.
How do you do something objectively? Well, you have to have rules. You have to not have conflicts of interest. You get information from people, and you have advisors who don't have conflicts of interest, and you do your best to just look at the facts in front of you. But you know, it can be challenging, and there are a lot of interested parties in some of these decisions. So, but that is really the goal of FDA. And I met a lot of people who they wake up in the morning and they go to work and they think they're making decisions that could, you know, eventually matter for the health of their own family. So they are trying to make the best decisions and not be biased. And you have policies to support that, but in the end, it's really about the people and what they care about to support that. And it's a great place, and there are a lot of great careers to work in these jobs where you get to see something that's going to hurt people and you get to take it off the market and protect them, or you get to help companies that are making great products get their products on the market. Those are really great jobs because you can go home and know that you're making the world a better place. And sometimes there's a big pandemic and your work is like actually saving the whole world. So thanks for the chance to talk more about public health, and maybe we'll see you again with Dr. Burks.